Hi, I'm Carrie. I believe healthcare is important to America, particularly for small businesses, because they don't have the leverage against the insurance companies that they need in order to be able to provide their employees with affordable insurance. And my husband is a small business owner. When he quit his job to become a small business owner, we had to take private insurance, and it more than quadrupled our bill, despite providing lower coverage.
Hi, I'm Jeremy Stahl here in Omaha, Nebraska, and I think that one of the greatest problems with healthcare right now in our country is that there's no transparency. People can't walk into a hospital or a clinic and know what they're going to pay for any given procedure. So I think that we can achieve greater transparency within our healthcare system without sacrificing some of the private control. It could be a government regulation program, and I think that's what we really need to get out of our new healthcare system.
Hi, I'm Jason Helvey. I'm a radiologist at the University of Nebraska Medical Center, and I'm here today holding a sign for healthcare reform because I believe that healthcare is a right. It's something that as a society, we have a responsibility to provide for all members of society. And I feel that our current system, wherein each dollar that is meant to be spent on healthcare through our insurance system, out of each dollar, 30 cents is taken by the system for either insurance company overhead or profit, and the cost that it takes physicians to be able to practice in that system and manage all of the billing requirements that insurance companies require for their practice. It doesn't make sense to me that 30 cents is taken out of every dollar that should be spent on healthcare for patients. And the opposition to healthcare reform commonly tries to scare people away from having government be involved in it by saying, do you want the government to be in a position between the doctor and the patient? But the reality is that right now, there is an entity between the doctor and the patient. It's not the government. Right now, it is private insurance companies that have an incentive that is quite a bit different than the government's incentive would be if the government were in that position. The private insurance company's incentive is for their shareholders and to make profits. And the government would have a different incentive, and that would be to provide health care for everyone.
My name is Jama, and I am here to bring awareness to the issue of healthcare in our nation. I've lived in the United States for the last 10 years. A couple years ago, I switched my job. I am currently a small business owner, and I noticed on my personal examples that the healthcare cost is spiraling out of control. I used to pay $180 a month as of 3 years ago, and right now I'm paying almost $600 a month. That is just one personal story. From a national standpoint, it is almost 20% of our GDP. Healthcare is dominating all the expenses, and I think it's negatively affecting our economy. If we don't do something right now, if we don't take resolute and concrete steps right now, we are risking to have even bigger crisis in the very near future.
My name is Kyla Hoskins. I go to Creighton University. My major is exercise science. My minor is public health. And I believe that every American deserves quality health care, no matter who they are, no matter what kind of health disparities that they need to overcome. In all my public health classes that I have been in at Creighton, you were taught that every human being, that healthcare is a human right, no matter who you are. Every human being deserves quality healthcare. And if I'm learning about other countries where it has been successful for many years, giving universal health care, then I believe that the United States should take action and make steps toward finding a goal of the public health option.